And this presentation is based on a survey that we carried out and analyzed in our team in Bordeaux. But this survey was under a service contract with the European Commission, and the report was published last September. So I'm not talking on behalf of the Commission, but only on my name. So to start with a little of background of this survey, at the end of the 19th, antimicrobial resistance has been recognized as a growing health problem, and that problem required coordinated actions at a European level. And this is why the European Council adopted in 2001 a recommendation on the prudent use of antimicrobial agents in human medicine. According to this recommendation, Member States were asked to organize and implement strategies and action plans to combat antimicrobial resistance and to establish a coordinating mechanism to ensure the coordinated and intersectoral implementation of the strategy in the country. This strategy and action plan should comprise measures on surveillance of antimicrobial resistance and antimicrobial use, measures on control and prevention of infections and prudent use of antimicrobial agents, and measures on training, education, information of the general public, and of course, research. So after this recommendation in 2001, a new recommendation on patient safety, including the prevention and control of healthcare-associated infections, was adopted in 2009, and this recommendation included measures asking member states, to implement measures regarding infection control and to establish a strategy that was coordinated with the strategy for prudent use of antimicrobial resistance. Besides these recommendations that were for member states, the EU adopted an action plan in 2011. This was a 5-year action plan for the Commission, comprising 12 key measures regarding the human health and the animal health, and it comprised measures regarding prudent use of antimicrobials, surveillance, and research. This action plan also comprised a commitment to monitor the progress made in promoting prudent use at the country level and at the European level. And this is why this survey was undertaken in 2015. The objective was to assess the implementation of the 2001 recommendation by member states. And this survey took into account the gaps that were highlighted in previous reports on the implementation of this recommendation, gaps mainly regarding the intersectorality of strategy, the surveillance system, and the monitoring and assessment of the strategy. It took also into account the measures that were recommended by the Council recommendation on patient safety, and it also considered the context at the time of the survey, that is activities that were going on in the European Union and also international activities such as the adoption of a global action plan on antimicrobial resistance by the WHO. The questionnaire used for this survey was based on the provision of the Council recommendation of 2001, and also it included inputs from activities going on in the EU and through a transatlantic task force on antimicrobial resistance, that is a task force gathering EU, United States of America, Norway, and Canada. The questionnaire included questions aiming at exploring the use of indicators to follow up implementation of the action plan and results, and we saw this morning that measuring is very important. It also included a question about the control of multi-resistant and extensively drug-resistant bacteria, antimicrobial stewardship activities in hospital, and the involvement of the nursing homes and other long-term facilities sector. This questionnaire was sent by the European Commission to the EU Health Security Committee that gathers representatives from the 28 member states of the EU and 3 countries in the European Economic Area. And this was done in June and July last year. So let's see together the main findings from this survey. 29 countries responded to the questionnaire. The first question were related to the governance and strategy in each country. So as you can see on this slide, a strategy to contain antimicrobial resistance had been adopted in 20 countries. And in 21 countries, there was a formal action plan. The difference between strategy and the action plan is that an action plan should really give details on the activity and who is responsible for the implementation of activity, and sometimes information on budget and timelines. It's interesting to note that the currently active action plan at the time of the survey had been launched in the 2 years before the survey. That is, they were quite recent and updated. And an intersectoral coordinating mechanism, generally in the form of a national committee responsible for the implementation of the strategy and action plan, had been set up in 25 countries. And this coordinating mechanism was really intersectoral, with representatives from human health, animal health, and the agricultural sectors. But some partners were more rarely involved, such as representatives from the nursing home sectors, patient groups, and nurses. Overall, there were only 3 countries that had not adopted a strategy or an action plan. We collected information on the content of the action plan in the 21 countries with a formal action plan, 2 countries with an action plan under preparation, and 2 countries where activities were carried out but without a formal action plan. As you can see on this graph, some activities were performed in all countries or most of the countries, such as measures on the prudent use of antimicrobial agents, surveillance, information of the general public, and education and training of health professionals. It's also interesting to note that more recent concerns, such as the detection and control of multi-drug resistant bacteria, extensively drug-resistant bacteria, was already included in this action plan. However, as you can see, some activities such as detection and control of outbreak research and the use of rapid diagnostic tests were included in the action plan in half to 1/3 of the countries. Let's focus now on surveillance. The surveillance of antimicrobial resistance is quite well implemented in Europe, with all 19 countries that participated in EARSnet, and most countries had also an additional surveillance system for antimicrobial resistance that targeted carbapenem-resistant Enterobacteriaceae in all 26 systems, and ESBL in most of them. This national system covered hospital care and ambulatory care in 2/3 of the countries, but nursing homes in only half of the countries. A system for alert and early reporting of some bacteria or event of public health concerns were in place in 21 countries, targeting CRE in most of the countries. Regarding surveillance of antimicrobial use, again, all countries participated in ESAC network, And an additional system was in place in 2/3 of the countries, covering in most countries hospital and or ambulatory care, and nursing homes in only half of them. Regarding the use of data that we saw this morning is also of high importance. It was only in 12 countries that prescribers had access to their individual data in ambulatory care. And at the hospital level, only 4 in 14 countries it was possible to have data at the hospital level as part of the current surveillance system. Regarding now prevention and preventive measures, in last year, in 2015, 8 countries reported that the sales of antibiotics, antimicrobial agents without prescription could account for more than 1% of total sales of this medicine, despite the fact that normally antimicrobials for systemic use are prescription-only medicine in the whole Europe. Electronic prescription were currently used in the hospital sector in 14 countries and in ambulatory care in 13 countries. Most countries had developed guidelines on prudent use of antimicrobial agents in the treatment of main community-acquired or hospital-acquired infections. However, evaluation of these guidelines were rarely performed. Only half of the country had assessed the compliance of prescribers to these guidelines, and the impact on practice of these guidelines have been assessed in less countries. The use of rapid diagnostic tests, which is very important, was in place in all but 3 countries, but encouraged by the government in 9 countries only. Information was collected on antimicrobial stewardship in hospital. 20 countries had legal requirement or professional recommendation for hospitals on selected measures. As you can see on this graph, the most common measures was to have in place a multidisciplinary organization in the hospital and facility-specific treatment. Human resources or activities relating to evaluation was less often required in countries. We had several questions regarding infection control. There were legal requirements for the number of professionals in hospital in around 2/3 of the countries. All countries had guidelines for infection control, but they had been assessed in half of the countries, and even more rarely in nursing homes. Regarding infection control, again, we had 18 countries that had already guidelines for the prevention and control of CRE, but only 20 countries that had guidelines to communicate on the patient, on the infectious status on the patient when transferring from one healthcare facility to another. Root cause analysis of healthcare-associated infections that participate to patient safety were required in 14 countries. Regarding public and healthcare professional awareness, campaigns had been conducted in all but 4 countries, and when it targeted professionals, medical doctors were more often targeted than others. An emphasis was put on the use of indicators. 18 countries describe the indicators they used to assess the implementation of their action plan and the results of their action plan, more often for hospital and ambulatory care than for nursing home sectors. Among these countries, 8 countries made the result of the indicator publicly available at the hospital level, and only 2 countries at the nursing home level. You have on this table example of the indicators that are used in the country to assess the program. the indicators relate to antimicrobial resistance and antimicrobial consumption mainly. Antimicrobial consumption is the indicator used in all countries in ambulatory care and in the hospital sector. For the sake of time, I won't detail everything, but you can find all the results in the report on the website. Some countries had set quantitative targets for some indicators, and we saw also that it is quite important to increase commitment for professionals to attain a target. So Ireland, France, Belgium set target for ambulatory care or for hospital care. For example, for the percentage of treatment lasting more than 7 days without justification, that must be less than 10% in France. So, but only 8 countries had set such target. So what can we learn from this kind of survey? Of course, this kind of survey has a lot of limitation. It is a self-assessment exercise. The fact that something is required at the national level doesn't mean that it is really implemented. It doesn't take into account the social economic context nor epidemiological context. But we can have a picture of what was going on in Europe last year, and what is calling for improvement. We need improvement at the member states level in the governance and scope of our strategy. We need to involve more the general public and patient groups, the nursing home sector. We need to progress regarding evaluation of compliance and effectiveness of our action, and also in training healthcare professionals other than medical doctors. So we need new initiatives to help member states to achieve more or less the same level. And we also need new initiatives because even in countries with comprehensive programs and action, we are facing high level of antimicrobial resistance and antimicrobial use. So we need to make a better use of behavioral science in communication to increase commitment of people and in implementation of activities. And we need to have more information on what is really effective in different healthcare systems. At the EU level, this kind of survey also had information, and this information will be used by the Commission to draw its next action plan that will be published next year. And the Commission will focus on activities with EU added value, mainly to support member states in the implementation and monitoring of a national action plan. And every action taken by the Commission has an impact on policymakers. It increases their commitment. At the EU level, it is also important to promote sharing of experience and sharing tools, building on the success of the European network managed by ECDC, the success of the European Antibiotic Awareness Day. And another EU added value is the support of innovation and research in many fields. And the EU will also collaborate with WHO, of course, in this field. So this is for this, some results of this survey. You can find all the details on the DG Santé website on the AMR pages. And I thank you for your attention.